Hi, everyone. MPP Jeremy Roberts here, and I'm delighted to be joined today by a very special guest, Dr. Adam Ritchie. Dr. Ritchie is a scientist at the Jenner Institute at the University of Oxford, which is the institute that's been developing the Oxford-Astra COVID-19 vaccine. He's an expert on immunology, lectures in human science, and just for personal reference, Dr. Ritchie was also my lecturer in the science and public policy class that I took in my master's at the Blavatnik School of Government. Dr. Ritchie, thank you so much for joining me today.
It's a pleasure, Jeremy, and hi to you and everyone else watching.
For sure. So what we've been doing over the course of the past couple of weeks here is we've been tackling some questions that we're being asked by constituents here in Ottawa, West Nepean about COVID-19. And of course, there's a lot of stuff that people are reading on the internet, seeing on social media, or seeing in the news that prompt a lot of questions. And so I'm hoping to ask you a couple of those questions that we're hearing, and perhaps you can shed a bit of light as an expert in the field.
Sure.
So the first question that I thought we could tackle is, we hear quite often from constituents who say, rather than taking the approach of lockdowns, as a lot of countries and jurisdictions have around the world, should we not be trying to work towards what folks are calling herd immunity? And a lot of folks ask, does this not mean that we should be, perhaps a bit more lax in our restrictions and let people be exposed to the virus to develop this herd immunity? Is this something that you could shed a little bit of light on for all of us?
Sure. So, as a vaccinologist and an immunologist, I'm quite a big fan of herd immunity. I think herd immunity is an excellent thing to have. But in all previous infectious disease situations, the only time we've ever gone for herd immunity has been through not allowing the disease to run wild naturally, as has been proposed by some people for COVID-19, but instead through vaccination. So herd immunity is just the idea that if enough people are immune to an infectious agent, it won't be able to spread through the population, and thus you bring it under control. And that's been achieved for a lot of diseases using vaccines. For instance, measles, just to take one case. And where you see measles outbreaks is where people have become resistant to taking the vaccine or don't want to take the vaccine, so vaccine coverage becomes quite poor, and that's when herd immunity breaks down and you get it again. So some people have suggested this idea of letting it COVID-19 sort of infect more people to get herd immunity. In theory, like a lot of ideas, this has some merit to it, in that, potentially if a lot of people get infected, a lot of people will then become immune to the disease. But there are a few issues with it. This isn't really a tested and tried thing. It would be trying something very new that hasn't really been shown to work particularly before. It probably would eventually drop the infection rate. But a couple of issues is, one, how long does immunity to COVID-19 last through natural infection? Some related coronaviruses like SARS, the immune response was not long lasting. And so that would be a concern that if we did take that approach, 2 years down the line, we would be in exactly the same situation with waning immunity and the disease spreading again. The other issue is, what's the cost of that approach? And this is something that all policymakers and societies need to balance at some point. What's the cost of the lockdown? What's the cost of quarantine? And I don't just mean the economic cost, the human cost as well, versus what is the economic and human cost of letting the disease run rampant? And that's something that needs always to be balanced. We don't do lockdowns for the common cold. We don't do lockdowns for the flu, because we judge the impact to not be as strong as the impact of COVID-19 has been. I was asked a very similar question last March at the start of the outbreak. And my point at the time was, I'm not ready to effectively say we can take a big risk with the lives of those who are vulnerable. So the elderly, those who have underlying conditions, I'm not really willing to go, let's just let the disease run wild. We'll get a level of immunity, because that's a huge risk to those people. And while they may say, let's keep them quarantined or keep them away, we're seeing, as things have spread through care homes in a lot of countries, that approach hasn't really worked. Unfortunately, I'd love it to work. I'm not enjoying lockdown. I'm sure none of us are. I'm homeschooling my daughter at the moment. It's a difficult situation for everyone. So I'd love to say, let's do that. But I think it would be a huge risk.
Fair enough. And kind of building on that, a lot of folks that we're hearing from in the office are pointing to different jurisdictional comparisons. And one of the ones we hear all the time is, should we not be looking at the model that Sweden followed, where they seem to have less economic and movement restrictions in place at the beginning of the pandemic in an attempt to move towards this idea of herd immunity that they talk about? Could you perhaps elaborate a little bit on perhaps why it is that most jurisdictions aren't following the model of jurisdictions like Sweden?
Sure. So it's been an idea that's been proposed in Sweden, or perhaps of the sort of Western liberal democracies, the one country that's carried that approach out the most. It's not been a popular approach in other countries. Of course, to me, there's a couple of issues. One, once you start it, you really need to stick to it, because it's not going to work. And if there is going to be a payoff, and as I said a moment ago, I'm not sure there is going to be, it is a successful approach, it probably will take quite some time. So if we look at Sweden at the moment, actually just in the last day or two, their government there has begun to introduce the ability to bring in lockdown laws there. That's something they've resisted for a long time, but they've started bringing rules about wearing masks in public, on public transport, bringing in the authority for the government to shut down places like gyms and shopping centres and places like that if they feel they need to. That's something they've tried to stay clear of. The way it looks at the moment is, if we can, the easiest thing to do is perhaps compare it to the neighbours sort of thing, the Norways, the Denmarks, the other Scandinavian countries. And unfortunately for Sweden, their approach has not protected them from the economic problems arising from COVID-19. Their economy has taken a very similar hit to its neighbours, but the impact of the disease has been much worse to date. So we're not yet seeing any evidence that this herd immunity is protecting anyone. What we are seeing is them it's winter, it's the cold and flu season. We were always expecting there to be a spike in the Northern Hemisphere at this time. If Sweden's herd immunity had worked, if their approach had worked, we'd expect their peak to be lower and there to be less impact there, but we're not seeing that. In fact, we're seeing the opposite, where they're having a lot more cases per capita than other countries are, and a lot more deaths than other countries are that are neighbouring. There are some countries doing better, some countries doing worse than them, but compared to their neighbours, they're doing the worst, unfortunately. I would have loved for it to have worked, because I'd love to be in a Swedish-style environment rather than the UK's lockdown approach at the moment, just personally. But that's just because I'd rather go outside and go somewhere.
Fair enough. No, really, really valuable information to know. My last question for you, and obviously as someone who's an expert on vaccinations and has been working on one of our COVID-19 vaccines, we hear a lot of questions about vaccines. And I'm wondering if perhaps you could shed a bit of a light on how important vaccinations will be in our fight to end the pandemic.
So, I may be biased because I work on vaccines, so it's sort of a focus of mine, but they look like they're our best bet for getting out of the situation we're in. Having said that, as someone who has taught, including Jeremy, concepts around public policy and things like that, I would always encourage a multifactorial approach, sort of thing. So not putting all your eggs in one basket. And with vaccines, what that's meant is government supporting lots of different vaccines, our Oxford-Astra Zeneca vaccine, the Pfizer vaccine, the Moderna vaccine, and lots of others. Of course, at the beginning, you don't know which ones are going to work. Where it looks, as we had anticipated, it looks like most will work, because this isn't the most complex disease we've ever seen from a vaccine perspective. So I wouldn't put all our eggs in one basket, but that goes also for the broader context. I think it's important to have other approaches than just vaccines. That's why people are working on treatments. Not surprisingly, as we've dealt with this for months and months, I say I'm not dealing with it, but my medical and nursing colleagues have dealt with this. They've gotten better at treating people, knowing when to use respirators and things like that. But then there's the broader approaches. How do you use lockdown? How do you use quarantine? The other thing I'm quite a fan of is the testing and tracing sort of systems that allow us to track who's been infected. When they work well, they work very well. When they don't work well, they tend to chew up a lot of money and not achieve much, unfortunately. So if they're done well, like a vaccine that's made well, that's something that can make a big difference as well.
For sure, absolutely. Well, listen, thank you so much for shedding a bit of light on some of these questions. very valuable information. And of course, on behalf of all of us in Ottawa and across Ontario, thank you for the work that you and your colleagues have done on vaccinations. It definitely has presented a light at the end of the tunnel for many of us. So thank you so much, Dr. Ritchie.
No problem at all. And I hope to be able to come and visit in person sometime soon.
Sounds great. We look forward to having you.
Thanks, Jeremy.